What do we got?
Avery Quinn, 28-year-old female, pedestrian versus auto. BP 80/45, heart rate 114, satting at 88.
Okay, Avery, I'm Dr. Marcel. We're gonna take good care of you, okay?
It hurt so much.
Trigger the MTP, get 50 of fentanyl. Here we go, guys. Transfer on my count. 1, 2, 3. All right, let's roll her. You're okay. We got you. The board. Okay, we're good. Avery, can you put your arms by your side for me? You're gonna feel a little bit of pressure, okay?
O2 sats down to
Avery?
82.
Avery. Avery, she's out. We need to intubate. 20 Vitamin 800 of sucks. It is CBC, CMP, type and cross 4 units. Let's get a fast scan and have them prep OR 12.
No, she's going to OR 7.
Excuse me?
Yeah, I'll take it from here. And let's add a coag panel and LFTs.
Dr. Blake, I think you're mistaken. This is a trauma, not a transplant surgery.
Yeah, I can see that. She's got free fluid and she's in shock. Her liver's ruptured but repairable. We gotta get her up now.
I'm in. Bag her. All due respect, Dr. Blake, you're a transplant surgeon. I got this.
Thank you, Dr. Marcel, but I'll be taking over the case now.
I'm sorry, I can't let you do that. This is my patient.
And I understand that, but she's also my daughter. Now I'm gonna need you to move. Let's go.
You got a transplant patient?
No, I don't. But we have a problem.
Dan, this must be hard for you, but that's the very reason I can't let you go in there.
I appreciate your concern, but I'm fine.
Dr. Blake,
Miss Goodwin,
you know very well it's against hospital policy to operate on a family member.
I am perfectly qualified to perform this surgery.
Pamela, you are a transplant surgeon.
Dr. Archer and I see these cases every day.
And I make more money for this hospital than any other doctor here.
That is not the point. Dr. Archer is a top trauma surgeon. He will do an excellent job.
I will. And if you're so inclined, I'd be happy to have you observe.
The Pringle.
Hold on. I didn't get a good look at the duodenum.
It's clear.
Okay.
All right, pulling back on the lap. Looks good.
What's her pH and temp?
7.34 and 36.9.
All right. Looks like you're good to close.
Actually, we're just gonna pack and leave her open.
No, her bleeding's under control. Packing her isn't necessary.
I disagree. She's got a grade 4 liver laceration. The risk of rebleeding is too high.
She's a healthy 28-year-old. Leaving her open puts her at increased risk for infection, coagulopathy, hypothermia, and acidosis.
Dr. Blake,
No,
Close her
point.
up, doctor.
I understand your concern.
No, point well taken. I see the merit in what Dr. Blake is saying.
Dr. Archer,
All right, hold off on the lap. I need Celox, gel foam, and get an Omaxin suture for Dr. Marcel.
Dr. Archer,
Dr. Marcel.
If you remember me from this morning, I'm the surgeon on your case, Dr. Marcel. How you feeling?
Like I got hit by a car.
Well, you did just have major surgery, but it went well. I imagine you will feel a little better each day. Yeah.
Here you go. Dr. Blake said to go slow.
Thanks, Dina.
Ice chips. My mom is in love with them. Frankly, I think they're just as much an aspiration risk as liquids.
Aspiration risk. What are you, you a doctor too?
Made it halfway through third year of med school.
Oh, okay.
Realized I was doing it for my mom, not for me.
Ah.
I'm assuming you've met her by now.
Made her acquaintance, yeah.
She tried to scrub in.
How'd you guess?
Ugh, I know my mom. She didn't talk to me for 6 months after I quit med school.
Wow, well, that's rough.
The day I took control of my life, best move I ever made.
Anyway, I should let you get some rest. Enjoy your ice chips, and I'll check back later. So wait, what did you end up doing after med school?
I'm a malpractice lawyer.
Medical? Your mom must be very proud. What's going on?
O2 sats are 91, BP's down to 83/50.
Drains are full. Belly's firm. Okay, Tomidate sucks and transduced to a bladder pressure. Let's go. Hey, Avery, look at me. You're rebleeding into your abdomen. I need to intubate and take you back to the OR, okay?
What happened?
Abdominal compartment syndrome. Going back to the OR.
No, no need. You can use a cordis catheter and decompress here.
There's too much blood. We don't have enough time. I'm in. Bag her.
And if you open her up, there'll be too much swelling and you'll never be able to close.
Get the cordis.
Dr. Marcel, bladder pressure's 35.
It's too high. We need to open her up to release the pressure. Get me a 10 blade.
Dr. Marcel, I already told you.
Back off, Dr. Blake. Here we go. Ready?
Sats are up to 96, and BP's 112/83. She's stable.
All right, get her up to the OR.
Make sure you get her swelling down. You're gonna need to close her up as soon as possible. And your drains are clear. So, if you get thirsty, you can just ask the nurses for some ice chips.
Ice chip.